So, you think you know what a urinary tract infection is? Well, that sudden, painful urge to go, it's really not a one-size-fits-all problem. You see, in medicine, context is absolutely everything. And when it comes to UTIs, the right diagnosis, the right tests, and the right treatment, they all depend entirely on one thing: you.
All right, so here's what we're going to do. First, we'll break down the single most important distinction in the world of UTIs. Then we're going to walk through 3 totally different case studies to see how this all plays out in the real world. And finally, we'll get into the modern playbook for preventing them in the first place.
Okay, let's just dive right in. Imagine this. You wake up with that classic burning feeling, and you have to run to the bathroom constantly. The very first thing any doctor has to do is categorize the problem. And for UTIs, it all boils down to one simple question.
Is this an uncomplicated UTI? Now, that term is super specific. It really only applies to a healthy, non-pregnant woman who has a totally normal urinary tract. This is by far the most common scenario, and it has its own very clear set of rules.
Literally everything else? It all gets tossed into the complicated bucket. This is basically the catch-all category for any UTI in a man, a pregnant woman, someone with a catheter, or, anyone with underlying kidney or bladder issues. And as you're about to see, that one word, complicated, changes everything.
So let's just put it side by side. Uncomplicated UTIs, they're usually stuck in the lower urinary tract. They happen in a really predictable group of people, and they're caused by the usual suspect bacteria. Complicated UTIs, on the other hand, have a much higher risk of traveling up to the kidneys, and they can be caused by a whole wider range of bugs. Getting this right from the start is the key to everything that follows.
Okay, let's make this real. I want you to meet Miss C. She's 25, she's healthy, and she calls her doctor with those classic UTI symptoms she's unfortunately had before. She is our textbook, picture-perfect example of an uncomplicated case. So she describes the burning, the urgency, that feeling of having to go all the time. But, and this is important, she has no fever, no back pain, and no vaginal discharge. She just wants to know, hey, can I just get a prescription over the phone? So what do you think? Does she actually need to come into the clinic for a test?
Well, the answer is probably not, and the reason is kind of fascinating. For women just like Miss C, with at least 2 of those classic symptoms and no other red flags, a doctor can diagnose a UTI accurately just based on her story, more than 90% of the time. So in this specific case, a simple phone call is often all it takes.
And the treatment? It follows that same simple, straightforward logic. The doctor's probably going to choose one of these first-line antibiotics. Notice how short the courses are. We're talking 5 days, 3 days, even a single dose. The goal is simple. Get rid of the symptoms fast without using a sledgehammer to crack a nut.
Okay, now let's flip the script completely. Meet Mr. J. He's 35, and he shows up with pretty similar symptoms. But there's one key difference: the fact that he's a man. And that one detail changes the entire playbook.
This is one of those hard and fast rules in medicine. A UTI in a man is, by definition, always considered complicated. It's just a matter of anatomy. These infections are way less common in men, so when one does happen, it automatically raises a red flag and requires a closer look.
So for Mr. J, the approach is way more cautious. A urine culture to figure out the exact bacteria is mandatory, not optional. The doctor also has to think about the prostate, because an infection there is a common cause in men. And because of all these extra risks, the treatment is longer, like 7 days, and often requires different, stronger antibiotics. It's a whole different ballgame.
All right, our final case takes us into the most complex territory of all. Meet Miss B. She's 40, and because of a neurologic condition, she uses a chronic indwelling catheter. She calls because she's feeling tired, she has a fever, and she thinks, oh, it's probably just another UTI from my catheter.
But here's the massive challenge with catheter-related infections. You have to think of a catheter as basically a super highway for bacteria right into the bladder. In fact, it's a sure thing. After just 1 month with a catheter, 100% of patients will have bacteria living in their urinary tract. This is called asymptomatic bacteriuria. And here's the kicker: it's completely expected.
Yeah, that 100% figure is so important. Why? Because it means a standard urine test is basically useless for diagnosis. Of course, the test is going to be positive for bacteria. It always will be. So for Mrs. B, finding bacteria in her urine tells her doctor almost nothing about whether she has a real, harmful infection that actually needs treatment.
This means doctors have to train themselves to ignore the very things they'd normally look for, like the classic urinary symptoms or even that positive urine test.
For patients like Miss B, the real clue for a true catheter-associated UTI, or a CAUTI, is a sign that the whole body is reacting. We're talking about a new fever or sudden confusion that has no other obvious cause.
So we've seen how different these infections can be to diagnose and treat. Now let's switch gears and talk about stopping them before they even start. And these days, the focus is really shifting towards smart, non-antibiotic strategies.
And you can see just how targeted these new options are. For women who get recurrent infections, it turns out certain high-potency cranberry products really can help stop E. coli from sticking to the bladder wall. For postmenopausal women, vaginal estrogen can restore the healthy bacteria that acts as a natural shield. And for others, a non-antibiotic called methenamine can be a really powerful alternative to being on preventative antibiotics for years.
You know, if you take just one thing away from all this, let it be this. A UTI isn't just a UTI. It's a whole spectrum of conditions. The right path, from how it's diagnosed, to how it's treated, to how it's prevented, is completely personal. It all comes down to your age, your gender, your anatomy, and your medical history.
And this field is not standing still. I mean, in mid-2024, the FDA approved a new drug called gepotidacin. This was a huge deal. It's the first oral antibiotic from a brand new class for uncomplicated UTIs in almost 30 years. It's a vital new weapon in the arsenal, especially with antibiotic resistance on the rise.
Which really brings us to the big final question. We are in a constant biological arms race against evolving bacteria. So as we develop these new treatments and get smarter about prevention, you have to wonder, will innovations like this be enough to keep us one step ahead in the fight against one of the most common infections on the planet?